Welcome to CAD Talks, tackling issues in your community. Today's CAD Talk is what does it mean to be digitally inclusive in Lancashire?
Wonderful, and good morning and welcome to CAD Talks, tackling issues in your community. Today we're going to be talking about digital inclusion and digital poverty in Lancashire. We've got a great panel. I'm going to introduce the panel and then I'm going to let them say who they are, what they do, and then we're going to go into the set of questions. We've got about 3 set questions that Jackie and I will do between ourselves. If you've got any questions based on what's said, please pop it in the chat. Obviously put yourself on mute as well. Pop it in the chat and then I'll look at it. If they come into, if they sound like they're good for straight away, I'll put that in straight away. Maybe ask you to ask it. If not, I'll pop it up at the end and we'll try and get through as much as we can. So, and no question's a bad question. So don't worry about that at all. Okay, we're just gonna have some fun. So what we're gonna do is we're gonna introduce our panel first. So I'm just gonna do it based off who I can see on here. So we'll start with Linda. Do you want to introduce yourself, who you are, what you do? That'd be wonderful.
I will. My internet said it was a bit unstable. So can you hear me okay? I'll turn my video off if it's not good.
No, it's good.
Okay, cool. You've all frozen as well, so do let me know if I go funny and I'll turn my video off. So my name's Linda Vernon. I work in Lancashire and South Cumbria Integrated Care System, which is the partnership of all the health and care providers, the hospital trusts and the primary care GP practices and the local government and the third sector and academia across Lancashire and South Cumbria. I work in the digital team. I have been leading on what's called digital personalised care, which is all about supporting patients and members of the public to access resources, to stay healthy and to access services in their community. And one of the things that's, I suppose, been growing in under my work is digital inclusion for the last 12 months in particular, although we've been looking at it for the last few years. Yeah, so really happy to be here. Thank you.
Wonderful. Thank you, Linda. Kerry?
Hi. Hi, I'm Carrie Harrison and I lead the Lancashire Digital Skills Partnership, which is a trailblazer sort of funded by the DCMS that sits within the skills hub of the Lancashire LEP, and we bring together public, private and charity sector organisations to address digital skills needs across sort of young people, the general workforce, and working with businesses, and specifically for today, the area of focus is digital inclusion.
Wonderful. Okay, we've got Caroline Waite.
Hi, I'm Carolyn Waite. I work in Lancashire Libraries. I've been dealing with sort of digital inclusion and digital devices and free internet access from libraries across the county for longer than I care to remember, probably 12-15 years now. So my role is supporting libraries and library staff to be digital champions, encourage people to use digital, get digital access, be safe online, and basically get the most out of being online and using the web.
Wonderful. And Sham? You're on mute. Should have brought the bingo.
Yeah, hi everyone. I'm Sham Sangha, I'm a Sham consultant. I kind of work in a variety of different areas. So number one is working with people who want to get their dream jobs. My background is around 30 years of recruitment experience. So I work with very experienced people. I used to work in London in the fintech sector. Right up to headhunter level, so people on 6-figure salaries. And now what I do is work with people up to that level, but also work with junior people. So they can be students looking to get their first job. They can be graduates coming out of university. So it's coaching them, and particularly on interview technique, how to write a good CV, where to look for jobs, how to present yourself the best way, and also how to work with recruitment consultants. I've actually trained many recruitment consultants in what makes a good candidate and what makes a good client. So that's one aspect of what I do. Another aspect is working with companies to improve their talent processes. So this involves meeting people, typically HR and talent people, who have got difficulty with hiring candidates, or maybe even losing candidates to other areas or other companies. And it's looking at where the holes are in their talent processes. So anything from how is the job description written, to who is involved in the interview technique, how many people are involved in the interview, as well as looking at how to pen offer letters together to get the best candidates as well. So in a nutshell, that's basically.
That's a bit weird, isn't it? A bit of an echo on that. We unfortunately have two people come joining us. Nadine is unfortunately has got COVID, and she is now in hospital, unfortunately. So we're going to send she's over to her. And we did have somebody else going to join us as well, but they've had to take a call. So we've just in the last couple of minutes roped in somebody from the group actually. So Joe, do you want to introduce yourself?
Yes, good morning all. I have to admit I was not expecting to be talking today, so you'll have to forgive me if any number recall or anything like that is a bit ropey. To very briefly introduce myself, I work at Lancaster University. I actually work with global research partnerships, so not that much relevant to this meeting. But as you can imagine, they went a bit quiet as soon as the pandemic broke. In fact, I've sort of been discussing COVID since 2019 because I would do a lot of work with China. So my work had been quite quiet for quite a long time. But my background I've worked with all local schools in Lancaster and Morecambe for a long time. And the university got asked by a local councillor to help address the challenge of lack of access to laptops, connectivity, etc. That was actually in response to refugees and asylum seekers. It was quite a specific request, and the university went back and said, okay, but they can't be the only ones struggling. And we broadened the question a bit, and so we simply asked schools, what do you need at the moment? What's most important? So it was a really diverse project that I ended up leading, which involved getting thousands of colouring pencils and crayons, etc., to primary children. We didn't get any tech to primary schools. They didn't ask for it. In fact, they said prioritise the high schools, as did the FE colleges, although we did end up getting a bit to them in the end. We did some really amazing activity boxes that were about encouraging creative play and providing the sort of things that we all take for granted in our house, probably roller sellotape, lollipop sticks, that drawer that you chuck any random thing in, or under the kitchen sink, providing that for young families. And then the stuff that's more relevant to this meeting, we provided 489 laptops to high school students and FE students in Lancaster and Morecambe, 360 odd connections with working with Vodafone for a few months, and providing a MiFi for those that are interested in the technical stuff. And we also did some online mentoring as well. So ended up being part of the national tutoring sort of service conversation a little bit. I'm kind of going all the way around the houses just in case people want to pick the bit that's most interesting to them. I'm not, to be clear, I'm not involved in the current initiative locally to provide laptops and connectivity to other children that don't have it, so primary children or those that don't have their own device, but I am in communication with them and I can try and represent them or at least connect you if you're interested in talking to them.
Wonderful. Well, thank you very much, John. Thank you for joining us last minute as well. Really appreciate that. A quick introduction to myself and Jackie, who are hosting today. I'm Elliot. I work for the Lancashire and South Cumbria NHS for the CAD team, hence CAD Talks, which is Community Asset and Development, and we help create groups and help make them more sustainable and things like that. And Jackie, you're on mute. I had £1 for every time. You're still on mute.
Sorry, that's not good of me now. I'm Jackie Robinson, and I have a business called The Balance Approach, and I provide health and wellbeing support to businesses, communities, schools, and charities. And I'm here today to co-host with Elliot to help bring awareness for so many different things. So thank you.
Wonderful. So what we're going to do, how the format works is I'm going to ask about 3 questions. I'm going to ask the first question and then the panel are going to answer it. If you have anything that you want to say to go with that, please pop it in the chat. We can put it in if we think it's relevant straight away. If not, we'll add it at the end. After the 3 questions, if any of those Q&A, we'll just start firing them away. You can ask it yourself. I'll bring up your name for that. Other than that, pop it in the chat and I'll ask it for you. So don't worry. So let's get started. So first question for our panel is, when I find it, is do you believe that Lancashire as a whole is doing enough to make itself digital inclusive? Who from the panel would like to get started? Or I'll just pick somebody.
I'm going to go straight in and go, no, we're not. I think we're doing loads, and I think there is a lot of wealth of swell of kind of activity and things happening. But I think digital inclusion sadly sat on the too hard to do pile for too long, and COVID has really pushed it forward, and it's really put it in the heart of a lot of organisations, but it needs to be in the heart of more, and to actually push it forward. So yeah, I think there's loads going on in Lancashire, and I think we're doing really well, but actually there's a hell of a long way to go to really support some of the people who are struggling the most in our county.
Wonderful. You want to jump in from that?
Yeah.
Hi, I'll jump in. Oh, Linda, me just going. Shall I go?
Yes, please.
Yeah, so I agree with Kerry. Yeah, it is hard to do, and it has been a difficult road.
And everybody.
A lot of on Lancashire with the Superfast Lancashire partnership. Sorry?
I said we lost you a little bit there.
Yeah, shall I turn my video off? Because I thought...
Please, yeah.
Yeah, okay. Sorry about that, yeah. So, yeah, I agree. I think, we've had some great partnerships in libraries. We've been working with Good Things Foundation and delivering sessions for sort of 10 years or more. But I think the questions are all around that. How do we really do that difficult part of the role? And, at the moment with the pandemic and everything, I think it has brought it starkly into view. And I think it is around, as much as anything, around data poverty. So it's fine. We know that people will get online and want to be online, but if they cannot get data, then it's not going to happen.
Sham, have you got? Yeah, of course you got your hand up.
I mean, in my experience, I agree with Kerry. Actually, I think there's a lot of talk about this sort of stuff, but there's not very much action going on. I have met various groups of people. I work privately with youngsters just to help them with their job applications, for example, or just how to create a really effective CV. And the impression that I get is that some of the stuff that these youngsters are being coached on is quite out of date. And also there seems to be kind of a fear almost from people in schools about digital and what it really means. And the upshot of that really is that we've got youngsters that are coming out of these schools and colleges with very little experience and also very little knowledge of how the real world actually works. And part of the problem, I think, is that the people who are doing the coaching, are working on quite outdated models themselves. So if I give you just like a small example, I worked with a candidate late last year, and she was told to put all, things like "I'm highly motivated" in her CV, with actually sort of putting it into context and saying, put somewhere in your CV that says how hard you work. All this sort of stuff is from years ago. And I also worked with a school leaver. He was 17 years old, and his CV had been passed by a careers officer at the college, and it was full of grammar and spelling mistakes. And I said, "Was this actually passed?" And he said yes. And I think one of the problems is that because digital transformation is taking place, and I get the impression that we in Lancashire are way behind on all this sort of stuff. I'm not sure whether the schools and the colleges have the resources and the skills in that area to actually pass on the information that's required to make our young people successful. And it's not just in the area of sort of CVs and job applications, it's also in the areas of mental health. I think the lack of understanding in terms of, what's out there, there's a kind of a negative connotation associated with social media, but there's very little talk about how positive gaming is and how positive, certain aspects of social media can be. So I think, we're way behind compared to other parts of the country.
Thanks, Sham. Linda, do you want to give it another go?
Yeah, I suppose I'd echo a lot of what everybody said. But in fairness, we're really fortunate that we have a digital skills partnership and a Kerry, who has brought so many people together. There's a really big network of us who, like, I'm looking even on the first page of the screen and I'm seeing faces of people that I know are doing great work out there. So there is lots happening on the ground. I think one of the things that's evident from health is that we're not good enough at being able to find the people who are most in need. So our best way of finding people when we have some resource to deliver devices or deliver skills and support and training is to reach out to our third sector partners and to say to the charities and the social enterprises that are working closely with people, can you help us find people? And actually, we're really good at working out who our most vulnerable people are clinically at the moment, and who's most at risk of, not just having maybe a few health conditions, but who also lives alone, or who, one of the things that marvels me is we look at assisted bin collections. So we recognize that if somebody has health conditions and gets assistance to get their bins collected, that probably makes them more vulnerable. But what we don't know about those people is, do they have access to a device and the skills to use it to be able to stay not just connected with health and healthcare, but socially connected with people while they're shielding and isolating. So I think there's lots of work we could do in better finding people and knowing who we need to support better. I think we're starting to do a lot of great work joining up all the stuff that is happening. So for example, I was just on a call earlier and there was 50 people on the invite list. I think about 30 turned up, talking about digital inclusion across health and looking at some projects we're about to roll out to support the BAME community and people with learning disabilities and autism, and reaching out to some of those sort of considered harder to reach populations. So there's great stuff happening, and we're collaborating well to make that happen. And health work with libraries and work with adult learning and work with our third sector. But whilst we still have people who are digitally excluded, then we're clearly not doing enough. So yeah, we can always do better.
Thank you, Linda. Joe, any thoughts?
I won't add much because I don't know how we compare to other regions, so I can't say whether we're doing better or worse than anywhere else. All I'll say is one of the things that Carrie said to me right from the first conversation I had with her, and Carrie was extremely useful to our project, so I'll sing her praises until for as much as I can. But what really impressed me about Carrie's approach was it was a family approach, and it really did have a huge difference to the project. So instead of just seeing it as these children needing a device, firstly we changed to these were for the family, and we were really explicit about it's not against the rules. It's not naughty to be using it to watch iPlayer as a family, or for mum and dad to be finding out what's going on with COVID, or just connecting with friends, or this a much more health, I suppose, in the context of this meeting, whatever's good for you with this device, use it. And I think you're seeing that a lot now with the tone of stuff that's coming out of schools. It's like, do some home learning, but prioritize your health. Do what you can. Make sure you're looking after yourself at the same time. And I think that it also highlighted some of the challenges to us as well, because the problem with with focusing on devices and to a degree connectivity is it's a tricky problem. without a device and without connectivity, of course you can't access stuff. Of course you can't go anywhere. You're at point zero. But I think sometimes that means that people then assume that as soon as you've got the device and the connectivity, you're fine, you're good to go. And actually, it's far from it. It's first step. And actually, for some families and for some households, it will feel like a backward step, because they'll get the device, they'll get the connectivity, but the kid might get it from school, but the parents have no skills or confidence. They might be intimidated. It might be a poor quality device as well, so they might look down on it or dismiss it. And the schools themselves as well, or the services that people are needing to access, might not be ready to provide stuff that's accessible or suitable for that way of engaging. So yeah, and I suppose to focus on the question about is Lancashire doing enough, I know of specific schools that have done a fantastic job in the last 6 months of anticipating what is happening right now, bringing in the right staff, preparing their children at primary level to know how to fix their own tablets, how to fix their own laptops so they can use devices independently. So there is some amazing stuff going on, to add a positive note, and there's some great examples that people can learn from within the region.
That's brilliant. I'm glad you brought that up, actually, because that was going to lead right into what I was going to say about it. Now, I've had a few chats with some other ones that work with people who are actually providing the laptops to children and things like that. And what we found is that the government scheme's laptops do not come with like Microsoft Teams installed. But they have a number of restrictions on them. So there is the expectation that the parents can then access and download Microsoft Teams. Now, I'm not sure if any people on the call use Microsoft Teams, obviously with this being on Zoom at the moment. Microsoft Teams can be incredibly frustrating to use. And so trying to get somebody who has no experience whatsoever to download it and have no issues with it is always a problem. So there is that issue with there as well. The other issue, as Joe pointed out there, with the connectivity, is the consideration to parents on low incomes in terms of electricity and home broadband use, because you will be using your own broadband. And if you have to go on things like YouTube, for example, or using Teams long term for your learning, that can absolutely cane your broadband if you're not on a really good deal. And you've got to also think about how much money those things cost. And there's also increasing costs. So it's not always just about what seems to be in the paper at the moment of, well, we need some laptops. You can have as many laptops as you want. If you can't get online, there is no point in having a laptop. If you can't stay online with the amount of stuff that you would need to use for that, that's what needs to be really looked at. And it seems to be being missed, but also the skills for the parents to be able to help the children get online as well needs to be looked at. But also you've got the amount of additional costs, like electricity, and we all know a lot of us are working from home at the moment. How much more your home costs have gone up? Electricity, using your gas, using your TV, using all that type of things. Those costs have not actually been considered when talking about, hey, we need to send over a couple of laptops to some children. And I think that's one of the things that needs to be looked at as well. But that leads us into our next question. And Jackie, would you like to ask this next question?
Yeah, I personally have been working with BAME communities. I've had a contract with a charity in Blackburn. And what we found was that we were doing health and wellbeing training courses by Zoom, but the ladies didn't know how to use Zoom. And so we did a bit of research, and we work with different programs, and we're now piloting an NHS app, which we will work and show them how to use it. So I'm going to echo what Linda said about working with the third sector. I think it's absolutely essential that we all collaborate to get to the people who really, really need it, because they're so isolated, these people, and the joy on their faces last week when I delivered a Zoom was incredible. So my next question is, what more do we need to do to improve this? Obviously, that's just one idea that Linda had, but what more can we do? And that's open to the panel.
Yep, of course,
Shall
Linda.
I go first?
Linda, yes.
And it's quite nice because I was going to make a comment at the end of the last question, but it probably fits in better now, really. And this is picking up on what Sham was talking about earlier on as well, around recognizing that digital is transforming every sector at the minute. So education is shifting into the digital world, health is shifting into the digital world, industry is shifting far faster than the rest of us, than the public sector, into the digital world. And there's something that's been sort of mentioned in the chat, and you were just talking about, Elliot, around funding. And in order for the funding to flow, we really need to start to insist that digital inclusion is considered as part of every single transformation program that happens in every sector. It needs to be considered first and foremost as a given that you won't transform education without thinking about the recipients of education and how they might be able to interact digitally with their teachers, whether they're in the real, in their home environment or in school. And the same with health. We have so much happening across health and care. There are over 360,000 health and well-being apps on the app stores, and we're not good enough yet at helping people to find the best ones to meet their needs, the ones that are the safest and the most reliable. And we are doing some of that work in health at the moment. And I can put a link in the chat about one of the services that we use to help sort of decide which apps are worth recommending to people. But we're not embedding that in the way we work. It's as though digital inclusion at the moment is seen as something that sits on the sideline rather than something that weaves through everything that we do. So I suppose my biggest push and drive and ask would be that we start to raise the digital inclusion exclusion flag in every single aspect of the things we do, and that we work collaboratively. We have to work collaboratively. We talk a lot about health and care and health and well-being apps, but even to try and ask a physio or a practice nurse to onboard somebody onto a health and well-being app is more than their appointment slot allows. So if we don't have our libraries, adult learning, third sector partners who are funded to support those people to onboard, then you can't really expect health and care to be doing it within the time slot of a clinic appointment, unless we start to change the way we work clinically. So I think there's a lot of culture, there's a lot of how do we get this embedded in the culture that this is the way we will move forward and we won't leave people behind, but we've got to do it collaboratively and we've got to resource it fully.
Wonderful. Kerry, do you want to jump in from that?
Yeah, absolutely. I mean, as a very basic, I think we need to move towards, as a country, that digital is like an entitlement. So access to the internet is something that is like water, electricity, gas. It's just something that people have. So instead of a winter, as well as a winter fuel allowance, for example, there may be a data allowance or that there would be some sort of basic level of internet access which you could then top up should you have the finances. But it's for me, it's got to that level that we need that like absolute basic kind of point. But obviously that's a political lobbying point that I can encourage, but I can't sign the dotted line and put in place myself. However, we've got to make sure that alongside that, I mean, we talked about how do we reach people. When myself and Carolyn worked on a project and that's ongoing to get devices out to people with data, we came up with some kind of underlying principles, and that was that we wouldn't give a device to someone unless we could support them with digital skills. So it is the device, it is the data and the data connection, and there is a lot of data poverty out there. But actually, it is about having that support and that motivation and that kind of courage and confidence to go onto that device and actually use it and find out why you should be using it. And those three things together are really, really important, as opposed to just thinking about a device or a data or the skills themselves. And we've got to show people how to the benefits of learning those digital skills and what that can bring them, whether that is health, whether they can find out more information about mental health, or whether it's allowing them to search for jobs, whether it's allowing them to access new skills, it's all those things, or save money. the stats on saving money, if you can actually access the the internet, is like hundreds of pounds a year for a difference between a family who can't access the internet. So I think all those kind of things are really important to sort of bring into this situation and help people with. We need to get more devices out to people, but we can't do that if we're not prepared to do the internet access and to support people with skills. I know a few people there, and the government have brought out this entitlement to essential digital skills training. So at level 1 and entry level, so really down at the bottom of the kind of qualification sort of structures, there is an essential skills qualification, and it is the basics of how to send emails, to communicate online, to buy things, to process information online. And that came into effect, within, well, I think it was September 2019. But we need to really push that, and we really need to get more people accessing that. But there's always that issue that whenever you put digital skills programs out there, it's all very well saying come and learn how to use a computer or however you phrase it, but actually people aren't interested in that bit. They're interested in knowing how they're going to save money on the next electricity bill, or how much money they're going to save on a holiday if they can afford one, and all those kind of how can I buy shopping online if I'm stuck inside for shielding for however many months. It's those skills that people are struggling with, and they need to have support in more short, sharp ways of doing that. And you know what, we have some great teams, the libraries, adult learning teams who've been doing that stuff and trying to pivot towards what's the motivator and not what the actual skill is. And we need to do more of that and support more of that. Clearly, that's hard during lockdown, and it's hard. Carolyn knows through bitter experience that we've been trying to support people over the phone with digital skills development, and that in itself is incredibly difficult. But there's limits to what you can do during a lockdown.
That's great, and that's a good one to put across to Carolyn about the libraries, because we've had a couple of questions regarding the libraries and
yeah, I mean, I just wanted to pick up there on what Kerry and what Jonathan said in the chat as well, is that the decision by Department of Education to stop the Future Digital Inclusion funding programme is going to really hit at the heart of the most digitally excluded citizens. It's all very well, and it's great that digital skills is now an entitlement, but that's almost that bureaucracy of a formal education route in a college is a huge barrier, and really I don't know what this group can do, or where we can actually put any of our voices to support something that says that future digital inclusion and that community learning is vital, because as Kerry said, and lots of people on here, I've seen people that we're working with through the CELNet project and that as well, we're reaching people now who have huge barriers to being online. Would have some motivation potentially, like Kerry said, but not a motivation to learn a curriculum of digital skills. You've got to do it in a softer way. You've got to talk about safety, being safe, and addressing those issues that people have got around, I don't feel safe online. The library services obviously had to do a lot of things digitally during the pandemic, and some of that is about how people can order and request books. Because they've needed to do it, they've learned how to do it, and they've learned how to do it safely. So I think that whole safe environment, be it over the phone with somebody that's trusted or face to face, is critical as well. And it's about finding people, finding those people and making sure that everybody in the community knows where to signpost them to as well. So obviously libraries have got free internet access, and we do one-to-one sessions under normal circumstances, face to face, and just generally talk to people all the time about what they can do online in our digital offer. So if you're stuck at home, you can read ebooks if you've got a device. So that there's different levels at which we can offer this. I'm just seeing what questions were asked, Elliot. Sorry, I haven't picked them up.
That's the thing with mute, isn't it? You forget you're on it. There's just a couple of.
Could I just come in very briefly?
Yeah, of course.
It's actually on the previous question, and one thing that COVID has really highlighted, I think, is that we've got parents, working parents to, obviously, if you can work from home, work from home. You've got the challenge of working parents trying to do their own work, sharing the same connection with kids that they're trying to homeschool as well. So these are kids that ordinarily would actually be in school or college even, but you're having to share the same connection, and quite frequently you have the difficulty of juggling your own calendar with the calendar of the school lessons. Now I've got a boy who's got additional needs. So the difficulty I have, I'm sure I'm not the only one, there must be lots of other people in the same position, is how do I set up my own meetings, which are all happening virtually at the moment, and be able to sort of coach and help my son with his schoolwork as well. And I think, while this pandemic is going on, and it's going to go on for some time, I think, certainly for the foreseeable future, this is an additional challenge that a lot of parents are facing. It's pretty important, really, that the ones who can perhaps do something are introduced to the relevant software, and with people's way of learning is all, everyone has a different way of learning, is making sure that whatever coaching is given to the parents is actually tailored according to the way that they learn. Because frequently you come across a trainer who only ever has one style of training, and he assumes, or she assumes, that everybody is going to understand how that works. So I think that's just another point I wanted to make, really.
That's great. I did double check. I think, Carolyn, you did actually answer the question regarding that. But Joey, I think you said you had some examples.
Yeah, I've got example usage. I'm just going to comment on what Sham was saying there, because it sort of speaks to what I was going to say about what more we could do. I think I agree with Kerry in the chat. Take training to people, but I don't think it can be the same provided. Put the training in the services that people are already accessing, whether it be the library, whether it be health, whether it be education services. Get it where they already are, but make it a new person. Get someone with skills, experience, etc., who can add that resource, add that knowledge to the existing team, to the staff, help their new colleagues to adjust their working practices, but also go through the channels that people are already accessing and provide some expertise, really. And that sort of changing the way you work. I think what more we could do, I agree with everything everybody's already said. Some of it's big stuff, right? Huge infrastructure stuff, expensive stuff. I think something every single one of us can do is think about digital access beyond just provision of equipment, but think about the way we work digitally, particularly with those that service users, to use a cringy term. So people can sometimes go one of two ways. They can either keep it very, very basic online and just have the same sort of format for a meeting every single time. We have to accept that that's really tedious and boring for service users if you're doing that all the time, and if you're isolated, and if it's the 5th Zoom call or the 10th Zoom call that you've got that day or whatever. So you do need to be prepared to put in some effort to make it more engaging. However, people can go too far the other way and start using websites, software, etc., that's really snazzy and really entertaining for those that have got very high level digital skills and digital literacy, but really intimidating and challenging. And I think it's sort of useful to put it in the context of the way we think about access, or the way we thought about access maybe 12 months ago. In terms, you wouldn't run an event in a building that didn't have disabled access. You wouldn't provide training that required people to bring a piece of equipment that cost hundreds of pounds, or that was really weird and wonderful. You make sure as a provider that you are bringing everything people need, and that you're including everyone. And I suppose that's my other last final point would be to avoid becoming digital only. That was something that I'm really pleased with. The project was far from perfect, and I will happily go into the warts and all of it, and I think I'm about to as well, actually, on the usage examples. But one of the things I'm really proud of with the project that we delivered, Connecting Kids, was that we delivered sellotape and colouring pens and sticky paper and stuff as well, because the more digital people are in their everyday practice, the more you also need to be non-digital. I think you need these breaks, you need help to do that. And it might be that instructions or ideas are delivered digitally, but you also need to be able to break away from the screen. The examples, if anyone wants the full breakdown, I'm more than happy to share it, but off the top of my head, so we gave 368 MiFis, which, if you don't know, it's a bit like a dongle. If you don't know what that is, essentially it's a bit like a home router. So the thing you're getting your Wi-Fi through now probably, but instead of bringing internet through an Ethernet cable that's on the grid, it brings in 4G in the same way your phone does. So it brings in internet into your home from outer space, and then broadcasts it to your home, so multiple devices can connect at the same time. So we gave one of them and 3 months unlimited internet to 368 families. About under 100 of those were really ever properly turned on. Under 100 we processed more than a gigabyte of data, for example. Okay, now we're still trying to get to the bottom of why that was, and I'm sure lots of people on this call already know the challenges of surveying teenagers in normal times, let alone right now. So we're still trying to work out what was going wrong. We don't think that the worst case scenario happened. We don't think it was a case of the technology not working or people not knowing how to use it. We think it may have been because, bear in mind, this was during first lockdown, so people were really up panic stations, and I think it was a combination of families and schools saying, yeah, we'll take that just in case. You know, they weren't 100% that the child or the family needed connectivity as well as the laptop, but better to have it than not. And I think the family also were thinking, well, our internet is a bit limited, maybe in capacity or quality. Let's try that as well, which I have to say I would do. But then they got it, and just you know, any of us that use our mobile phones in Lancashire know, connectivity can be patchy. So they may have been able to get stuff through it, but it might not have been better than the access that they already had. And that's the other thing as well, right? I mean, I think people have alluded to it already. Connectivity is not binary. It's not you're on or you're not. You can be on and you can have really poor quality, which, you know, as Sham said, means that you can't have two people using it at the same time. You know, you can't have somebody relaxing watching. You know, you can't distract a 2-year-old with, as I'm discovering, with Disney Plus, and have a Zoom call in the same house. I get about 5 megabytes a second where I am. So, you know, there's all of that. Those that did use it really used it. So this is unlimited, and we had one teenager who was using about 600 gigabytes a month. That's extremely high. The more sort of common example would be between 100 and 350 gigabytes a month, which is a lot higher than most mobile phone contracts. It's basically you need unlimited is is the simple way of saying it. Yeah, I think if you're providing connectivity to people for educational or work purposes, it has to be unlimited. A Zoom call, I think, is about a gigabyte for an hour. Roughly, that's really crude, rounding down, but certainly if you're streaming anything, again, that's about a gigabyte an hour, so it adds up pretty quickly. Yeah.
I'm just going to jump in on there, Joe, and say I absolutely agree with your thing about not to forget people, and that paper or scissors or sellotape is so important. And I think, you know, Linda mentioned about transforming services, but I think for the next couple of decades, we really need to ensure that every time we talk about digital transformation, we don't forget those people who are not in a position to actually move forward. And yeah, that could be about trying to get them access to the internet or whatever else, but it also might just be about having a phone call where they could ring somebody up and talk to them and figure that out. I know Blackburn with Darwin are doing a lot of, council are doing a lot of stuff in terms of moving forms online, but as they're designing those forms, they're asking people about how to put them together and how would be best for them to look and make it easy for people to complete those forms. But they always have a phone number that someone could ring up and actually say, can you help me fill this form in? And they'll do it together online through the phone call, and one person will put the information in so that they're supported through that. And we need to just keep making sure that we've got those alternatives and we don't just ditch them because you've got a new shiny online system, because otherwise we'll lose lots of people in the process. So definitely in terms of that, I just wanted to throw that in.
Right. Oh gosh, there's so much information coming in there. You know, personally, I really believe that we need to get really low level and make everything a bit more simple for the people who are really suffering from poverty. And I see some comments coming in, you know, social prescribers and the volunteer section are trading them up. And I think they're all great ideas. There's so many fantastic ideas there. But the third question is, what support is already out there for those in need of digital support and in digital poverty? So what support do we have?
To quickly interject in there, if anybody on the group have something that regarding that, if they have a project going on and everything, please pop it in the chat and with the link, so then everybody can access that as well. But yeah, if you want to start off, Sham, were you going to say something?
Not at the moment. No, I'm just making some notes at the moment.
I think I'll start off in terms of digital support then. There is a lot of organisations and a lot of projects, and we have a lot of partners who offer digital support, and a lot of that digital support is there is courses and there is things that people can sign up to, and you know, people like Lancashire Adult Learning are running Zoom how to use Zoom sessions for people who are nervous about doing that and trying to support people. So there is different partners, and some digital skills are taught a bit by stealth, in that they have there is projects that are about employability or about other things, raising confidence, and within those maybe some development of digital skills to help. So there is a lot of partners, and I do take someone's, I think it was Jonathan's comment in the chat, that not everybody likes to go to a shiny building or feels confident enough to step foot in a shiny building. So you know, there is organisations out there, not so many that I know about in Lancashire, that have been going into people's houses and trying to teach them one-to-one in people's houses. And you know, there is a lot to be said for some of the some people who are not confident enough to even go as far as a library to get help, because you know, the libraries do some great stuff with Good Things Foundation. We've been promoting the Idea Award as something people could go and access and use, and to be honest, the amount of online training there is quite phenomenal. However, it's quite it's probably quite overwhelming if you have a device and can access stuff to actually find what you want to do. And I know that's one of the reasons we have set up, as Lancashire Skills Hub, we set up a website called skillsforwork.info, and that was a starting point. And literally on the front page, it kind of just says, are you unemployed? Are you aged 18 to 25? There's different categories on the front page to actually try and make it dead easy for people to sort of find the thing that they're looking for. And we've collated there, working with partners, the types of training that is available. However, that involves obviously having a device and being able to have the confidence to be able to access and search and do all those things. But there is a lot out there. But then you've got adult skills services who will do things, will have, you know, Blackburn with Darwin Adult Learning have had a telephone number that people can ring up and get support through, as well as having online sort of courses. So there is training out there in different means, and maybe we could do more to bring it to people's doorsteps. I know of another trainer who runs training in the local Wetherspoons pub in certain areas, for example, in Northallerton. But and I think there's probably ways to go through that. And I know there's community voluntary organisations that have been running some fantastic digital skills training to help people. So there is a lot going on. You know, and probably we could take steps towards doing more that is sort of probably a bit more covert. One of my favourite projects, and I'll finish on this one, I'll shut up for a bit, is the NHS, NHSX or NHS Digital, one of them ran a project where they basically had a cafe, and it wasn't badged up NHS anything. It was just like a cafe where people could go to find out more about health things. And so they could go in and do that kind of, oh, my shoulder hurts a bit like this. What does that mean? And actually what people did in that cafe, apart from give people brews, was actually go and teach them. So, well, actually, do you want to book an appointment with your GP? This is how you do it. Or have you been on the NHS online and had a look at what those symptoms are or what that means? And they did training by stealth. Now, I've mentioned Blackburn a lot, but you know, Blackburn with Darwin and their library teams, they have been running that with the Good Things Foundation, a similar project up until COVID, well, up until the COVID epidemic in Blackburn. And that kind of approach where we get to people by the reason that they want to talk to you about it and then show them the digital means. I think that's really important, and more projects like that would be really useful. But yeah, just to sort of, you know, there's lots of training out there. It's whether people can access it or feel confident to be able to access it.
Can I come in from libraries?
Sorry, go on.
Interview. Sorry, Sham. Yeah, so I think Kerry's absolutely right there, and lots of comments in the chat are all saying the same thing. This is about knowing the right starting point for people that are out there who haven't got skills, or there are barriers to wanting to learn or to using the devices that they've already got. And I think, you know, libraries have proved that sort of by stealth through the pandemic. You know, people have sort of been forced to give it a try and manage their own accounts online, and it's a good way in to sort of go, well, if you've done it once, then sort of online shopping's similar. So you've got the skills, you've got that awareness of safety and things to be able to do that as well, and managing your health and reporting things in, say that the app about COVID and reporting that every day. We've also done things. We bought a lot of sort of coding kit that we were hoping to start rolling out sessions in libraries for sort of families and older people and cross-generational and everything, to make it fun. So it's not a digital activity, you know, it's not coming to learn a digital skill. It is about, you know, having some fun and being creative and using some of, say, the coding kit that we'd got on that to develop that awareness that, yeah, it is fun. It's not a task to do it. And I think I've put in there that, you know, the whole point is that what you need is resource. You can throw as many digital devices our way as you like, but the hours that it takes, and our team have been involved with this, of, you know, over the phone with somebody, just getting them used to using that and making them feel safe to use it and want to keep using it. It takes a lot of time. And I think that is our biggest challenge. Is we're all there, we all want to do it, but how much time is there? How much resource can organisations put to this without some sort of funding for it? Because the benefits are immense. Linda will know, obviously, from an NHS point of view and from social care and everything, that, you know, keeping people healthy, their minds working and connected, is got to be sort of cost saving in the end. But it just seems, like Kerry said, very first thing is it seems too hard to do, and it shouldn't be. Thank you.
Yeah, sorry, Sham. Yeah, jump in.
I was just going to say, I mean, that the question was what support is out there. I think there's probably lots of support out there in sort of like small pockets in various places. What is difficult for certainly me, and I'm sure a few others, to fathom is where do you go? Because, you know, there could be 3 or 4 places in one zone, there could be another 3 or 4 places somewhere else, and you've got all these disparate people actually doing stuff. But there doesn't seem to be like one place where you can go to access all of the information. So that was like the first thing. And the second point was that as far as accessing people, you know, who are interested in digital transformation, I think what you've got to do is you've got to go where the people are. So what I mean by that is that if people are hanging out on Facebook, so the older demographic is now on Facebook, the youngest people are on TikTok, you've got to target those areas, those channels, if you want to get the interest from the people that you're looking to target. And I think, I'm not sure how many companies, how many organizations these days actually think, where is our audience? One of the things that I do, when I do a talk, I've done talks for sixth form students, I actually use exactly the same language that they use. So, you know, when I'm talking to them, I use the same words that they use. Now, to us older people, they probably sound, you know, quite foreign, but if you're going to create a connection with the people that you're targeting, you've got to speak their language, and you've got to access them at the point where they are, rather than, you know, expect them to come to you. So I don't know how many people, you know, use that method, but for me, it just seems to be a fairly logical step. If I want to access the younger, you know, Gen Z people, I'll go to TikTok, I'll go to Instagram. You know, if I want to target older people like us, you know, I'd probably go to Facebook and look at the demographics from there. I'm a big believer in using data analytics to help any business move forward. So, but again, because digital transformation brings up all kinds of things that are related to this, again, data analytics, data scientists, this is where all the action is at. But again, I'm not sure how many people actually use this sort of stuff. How many people use data? You know, in terms of answering this particular question, I don't know how much data analysis has actually been conducted, you know, in the background to see what support is out there. So, you know, it's actually kind of like approaching it, and we talked about this earlier on. Digital is here to stay, you know, and you can either roll with it and get used to it and adapt to it, or you're going to become a dinosaur. And you know, those are basically your choices. I think the worst thing about it is that we have got people who can't access any of this support because of low incomes and because of poverty and stuff like that. That is really where I'd like to see a huge emphasis, you know, being placed, is how do we access those people? Because the vast majority of other people have got access. You know, everyone knows someone who hangs out on Facebook, you know, all day long, and they don't do much with their kids. You know, I've actually worked with, I worked with a family who had serious issues in this area, and they were all sat around a table, that 2 kids, 2 adults, every single person was actually on their phone at dinner time. You know, no one was talking to each other. It was incredible. And really, the way I see it, you know, how are we going to access these people? You access them using the method that they use to get into the, you know, to access the world, I guess.
Yeah. Can I follow on from that?
Yeah.
Because I think Sham's just used one of the phrases. Well, he's just described one of the phrases that we use an awful lot, which is reach people where they're at. And where they're at might be on digital channels like Instagram for my kids or Facebook for me, or it might be non-digital channels. It might be their local church or their local community group or knitting club or whatever. So I do think that that's got to be one of our angles. The other angle that we always use in healthcare is what matters to you or what matters to me. And we do recognize that whilst improving health and health outcomes is my big agenda item, actually, if somebody's needs are that they want to be able to communicate with their grandchildren by video and they don't have the skills to do so, then getting them on board for what matters to them is still getting them on board and online. So I think what matters to me and reaching people where they're at is really, really important. And I think it was Carolyn who mentioned about health outcomes. There's a fabulous paper that was written in a report written in by Public Health Wales, looking at digital inclusion and health inequalities and health outcomes, and they looked at it from the direct health and well-being perspective, but also by addressing the wider determinants of health. So Kerry mentioned earlier that, you know, people who are online are more likely to earn more money. They're more likely to get a better job. They're more likely to be better educated. And then in turn, we know that all of those things make you more likely to be healthier. So that, you know, that we know that it's a win-win if we can get people on board. We're starting to look across our sort of health and well-being focused group at creating a bit of a menu. So Kerry's got lots of resources on her website, but we're aware that within health and well-being, and I think there's some link workers who've posted in the chat, we need people to be able to find the right resources and the right support that's in their locality. So understanding what's your local library providing and what's your local adult learning organisation doing, and which charities, if you've got a patient in front of you who's from, let's say we've talked earlier about learning disabilities community, then is there a learning disabilities group that are working on digital inclusion with us in health? So I think it's about partnership, but it's also about providing a bit of a catalogue of resources, which is one of the things we're doing in the ICS, where I think I've put a couple of links higher up in the chat, and I've put my email address if people want to connect as well, because we're trying to map out a lot of the different opportunities that are available, building on the stuff that Kerry's got, but specifically thinking about health and well-being. And so there's probably people in this group today who are doing stuff that we're not, that's not on the map, and we need, like Dawn said, I think in her chat comment, we need to get it on a map, really.
Joe, do you want to finish this off, and then we'll on that question, and then we'll do a few quick questions, and then we'll call it a day.
Well, I have a lot less awareness of what's available locally than everybody else on the panel, so I'm not going to go on for very long. But I will give a shout out to the uni actually, and I'll say that there are a number of academic colleagues of mine who are action-based researchers, and for those for whom that's HE jargon, it basically means they're interested in doing. While they research, they don't just want to hear about it and read about it and sit in their office. They want to work with you to shape the activity as it's going in a more iterative way, but also help you to share that learning, that best practice, and learn yourself from what's happened. Off the top of my head, in particular, there'd be our design school, there'd be our educational research department, and very relevant to this as well is our School of Computing and Communication and the Faculty of Health and Medicine. But I could go on. But basically what I'm saying is, if there are people in this room who, I wasn't planning on doing this, but if there are people in this room who are thinking, actually, I'd quite like a bit of help with impact evaluation or design or understanding what I'm looking at in terms of the community and the demographics and what people are telling you, then just drop me a line and I'll try and play matchmaker. No guarantees, of course, but my job relies me to have a good network of academics at the uni, so I can always try and to dig someone out.
Thanks, Joe. You've just basically said my entire role of just saying, well, I didn't know I was going to do that, but yeah, go on then. That's basically my entire role. So yeah, go on then. We'll just give it a go. So no, brilliant. Thank you. And then thank you to everybody on the panel. Now, I did put in the chat, and there was lots of questions, and I do think we answered quite a lot of them during the talk and everything. But if anybody does have anything that they would really like to ask, we will pop 2 questions in quite quickly. So if anybody's got anything that they would really like to ask anybody on the panel, just jump in now quickly. No, brilliant. Right, okay. That's brilliant. Does anybody from the panel just like to finish off with anything?
Could I just apologise for not using chat? I've concentrated just on watching everyone and listening to everyone, so it got my full attention. So apologies.
It's a skill, Sham, don't worry about it.
If I haven't answered that yet.
No, I really appreciate everybody joining us today, and that it's been absolutely fantastic. There's loads of information on here. Now, after this talk and everything, what happens with it is Jackie will send it over to me for the recording. We then get one of our team who's absolutely brilliant at it, who then puts a front cover on it, puts an introduction into it, a bit of music, and then we share it across our social media, which is in the chat there as Connect My Community NHS. It's on Facebook as one of our groups. We also share it on our YouTube channel for the actual trust, which I will put a post in there for it. We'll also send out a survey later on to ask everybody what they thought, with links to the YouTube channel. And if anybody from any of the panel would like this video to be embedded into any of their stuff and everything, just let me know and we can get that put in there. Just one last thing. We did get a question that's just quickly thrown in from John. John, do you want to ask it yourself, or do you want me to ask it for you? I'll ask it for you. Okay. So it's for Joe. Are there any plans for stage 2 after the initial giving out of the dongles for access, or is it collate data before deciding where to go next?
Yeah, tricky question. So yeah, there's a huge effort at the moment in Lancaster and Morecambe, certainly, to continue to provide devices. It's not connected to what I was doing previously. I think mentioned before, it's targeted. It's finding the kids that we think, we're fairly confident we gave a device to every high school student who didn't have one within the home. Okay, that's the question we went out to high school students. So we think we met demand. Obviously, there will be new high school students coming in, devices will break, demand will change, and people's circumstances are changing pretty rapidly at the moment. That's one thing that I would say as well, if I can, just off the top of my head, the one thing that I think we trusted people when they talked about what they needed. We didn't go off stats. We didn't provide them to free school meals pupils or anything like that. We just asked people if they needed one, because we probably provided quite a few devices where there already were those in the home. But ultimately, as people have already spoken about, if you've got 3 kids, even if you've got one and you've only got one device, and that device might be an old tablet or whatever, then if you're perceiving that you need to boost your capacity digitally, then that's fine. So that's who people are continuing to work with locally. So there's a guy called Dan Knowles locally. He's doing a lot slightly different to us. We were fortunate. We were very successful with our fundraising, so we were able to buy new and distribute, which solved a lot of the challenges of software, licenses, quality of device, of everything, and speed as well, of getting things out. And we gave out through the schools, whereas Dan is refurbishing devices. I know that they are looking to buy dongles to provide them for people who need them. They're getting them at a lot cheaper than I did, so I'm very jealous. I bought through the first lockdown where prices were absolutely ridiculous. So that's the sort of broad answer for the Connecting Kids project. The project itself, the laptops and the dongle side is done. We aren't planning on providing any more devices, mainly because it's not the most sustainable thing we can do. We can't continue to provide devices. And I'm sort of saying we in quite a vague term. It's easy to see we as the university, but really the university was just one partner. We were working with like the City Council, we were working with Eden, we were working with lots and lots of people, CBS, etc. So yeah, there's no plan to continue providing devices through the Connecting Kids project. The bits that will continue are being embedded into existing services. So the university's Students' Union volunteer program, they're providing the mentoring that went alongside the devices. And we aren't really willing to expand in a way that's unsustainable, i.e. we don't want to give out a device where we can't also provide mentoring or support. The other stuff I've mentioned, like the giving out crayons, and the really cool bit, which I'll talk to anybody for ages about, which is the activity boxes, that was really innovative. That's continuing and growing. So yeah.
Oh, that's brilliant.
Sorry, I don't know if that answered the question.
I appreciate that, Joe. I hope that's answered your question there, John. No, brilliant. So as we said about what will happen with the video and everything else, our next talk is in February on Eventbrite, and we're going to be doing autism and LD. And what sport is out there and what more we can be doing and everything. So if you want to jump on that one, we have also got one for hoarding in March, hoarding awareness, and then we'll be doing an overview around the end of March of how COVID has impacted on community services and services in general, really, the good and the bad. So that'll be, they're all available on Eventbrite, they're all free and everything. We really hope to see a lot of you on there.
Thank you for watching. Our next CAD Talk is autism and learning disability. What more can be done? See our Eventbrite page for details.